Hello, I'm Julia Skapik, the Medical Director for Informatics at the National Association of Community Health Centers. Thank you for joining us for our How I Practice video series on screening for anxiety as part of the Women's Preventive Services Initiative. This project was supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services. This information or content and conclusions are those of the author and should not be construed as the official position nor policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. In addition to working for NAC, I'm also a board-certified internist and clinical informaticist. I practice currently with the Neighborhood Health of Virginia as a community health physician, and I don't have any conflicts of interest to disclose. Anxiety disorders are among the most common mental illnesses in the United States, with approximately 30% of adults in the U.S. experiencing anxiety during their lifetime. The prevalence of anxiety disorders is nearly double among women as compared to men. Anxiety disorders are often undiagnosed, and the recent COVID-19 pandemic has only amplified these numbers, with patients who already experience anxiety having exacerbation of their symptoms and patients who haven't really struggled with anxiety before significantly reporting new symptoms of anxiety and depression. Anxiety has a significant impact on people's functioning and daily quality of life. Studies on adult outpatients have shown that even separate from physical illness and other mental health and social determinants of health, that anxiety contributes in an additive fashion to the prediction of poor functioning, reduced health-related quality of life, and more sick days from work. Anxiety disorders include several related conditions characterized by excessive, uncontrollable worry. These include generalized anxiety disorder, in which symptoms are constant or daily, panic disorder, where there are episodic attacks, separation, social phobia, and specific phobias, which are all experienced in a contextual way, and selective mutism and agoraphobia, which can interfere with a person's ability to interact with the others in a social environment. Anxiety increases your risk for major depression over the following year and is associated with unhealthy behaviors and higher medical utilization, including worsening of somatic symptoms. Screening for anxiety in adolescent and adult women, especially in those who are pregnant or postpartum, is important, both because of the high prevalence of anxiety and because it tends to be under or undiagnosed. Women's Preventive Services Initiative recommends screening for anxiety in adolescent and adult women, including those who are pregnant and postpartum. Optimal screening intervals are unknown, and clinical judgment should be used to determine screening frequency, although patients who have or report social determinants of health needs, high stress, other mental health conditions, substance abuse, should probably be recommended for frequent screening. Additional screening instruments that demonstrate moderate to high accuracy can be found on the WPSI website, but a few to note are the EPDS, which is specifically for pregnant and postpartum women, the PHQ-4, which is related to the PHQ-2 and 9, which are used for depression, the HADS, which can be used in adult women, and the Bright Futures YPSC, which is particularly good for adolescents and younger women. In terms of how I practice, I find that especially during the COVID-19 pandemic, that patients are frequently coming forward with anxiety as a presenting symptom. They may use the term stress or worry to present with anxiety, but of course, open-ended questions about anxiety are very useful. You can ask if you would say the patient is under a lot of stress, if they're worrying a lot. It's appropriate to also screen asking about mood when you're asking about anxiety. You should probably include for patients who respond positively a screen for severe mental health symptoms like anhedonia or suicidality. And of course, asking the patient if they're open to counseling or other kinds of therapy for anxiety is important. Developing a therapeutic relationship, i.e. talking with them over multiple visits, may be helpful in sort of increasing acceptance for patients to consider some sort of professional help. I can say that this can be done successfully using telehealth. Right now I'm practicing at 100% telehealth, and I've had a number of patients who have come in specifically for anxiety to telehealth visits. It can be helpful also to refer those people to video counseling, which is something that several of my patients have told me they actually feel more comfortable in a telehealth counseling session than in an in-person one. We have telehealth resources on the WPSI website, as well as a billing and coding guide to support payment. Coming soon, there'll also be an interpersonal and domestic violence and contraception video in the How I Practice video series. The How I Practice videos will be posted to the WPSI website. Join the listserv for announcements and to be notified once the videos are released. You can also get patient perspective videos and webinars. You can subscribe through the womenspreventivehealth.org website or click the link at the end of this presentation. These are a few more useful resources that you could refer patients to or that you can read up on how people experience anxiety. And if you have questions, you can contact the WPSI staff, wpsi@acog.org, or join the listserv by clicking the link here or going to womenspreventivehealth.org. Thank you.